I want to say that international collaborations happen every other day. And when there is a discussion around having an isolation center in Kenya, it's not a bad thing, really. And it's a discussion. Because emergence of diseases and reemerging of diseases will keep recurring every other time. Really, as a country, we must be ready. And these are not strange things. Even during COVID, we had isolation centers in our country. Even the counties are supposed to have isolation centers. Today, we are at risk because of Ebola. If we have it here in our country, what happens? We will need isolation centers. In response to the ongoing regional outbreak, we have been able to activate our national incident management system. And the government has also intensified surveillance at ports of entry. You have heard my CEO from Cambridge is at the border, coordinating issues at the points of entry, designated specific laboratory for testing and we have also strengthened both national and county level coordination. It is a matter of life and death. We do not have an excuse as to why we must not get ready to protect Kenyans. As at yesterday, we do not have any confirmed case in Kenya. Yes, we have had samples. We have taken them to the laboratories, the designated laboratories, because not all laboratories have the capacity to do that. And we remain at risk of the disease importation, so let's all be careful. If you don't have an urgent travel in those countries, why do you have to go? Kaa hapa. Then we have also mapped out the high-risk areas, in our country. But we are continuing to screen people, travelers. More than 55,000 travelers have been screened. We do not have any traveler in isolation as at now. We do not have any traveler who has been taken on referral. We have our rapid response teams on the ground, 24/7, 24 hours on standby also, just in case there is any call. Anything that comes from an international request, it goes by the laws of Kenya. So we will not be breaking the law to have a conversation with partners. Not just the US, but any other partner. It goes by the laws of Kenya. So we want to affirm that our country we are ready, we are capable, and the ministry, we have taken all actions to ensure that we continue being guided by our healthcare workers and our policies to protect our boundaries and also to ensure that every Kenyan is very, very safe. As at yesterday, and you know very well, the World Health Organization declared the situation of Ebola as a public health emergency of international concern. And that was just the other day in May. The Africa Center for Diseases, they have subsequently declared that it is a public health emergency of continental security. And in DRC, we have many cases that are suspected, but they have already lost more than 100 people. In our neighboring country, just here in Uganda, they have about 10 cases, 7 to 10 cases that have been confirmed, and they already have a death. So our proximity to these countries is what should keep us on set, and we are on high alert as a ministry. Therefore, cross-border importation has been confirmed in those countries. And we are doing whatever possible. If you go through the airport today, you must be screened. You're coming back, you must be screened. And we must isolate those people who we may have to suspect or that need to be isolated from other people. And our labs have really been enhanced. You know, in 2019, 2020, during COVID, we could send our samples as far as South Africa. That is how low we were. UK, India. And it will take 1, 2, 3, 4 days before it comes back. And then we could say there's a confirmed case. But today, our labs have the capacity to test and give results within 6 hours, 6 to 8 hours. So that's an improvement. And we will continue to ensure that our partnership with other players, we are enhancing, and the testing of our samples in the country. We are also very deliberate on long-term investments in terms of health systems, public health surveillance, and workforce development. And notably, Kenya Health Professionals, previously, we have supported other countries in the response, and especially during Ebola outbreak in West Africa between 2014 and 2016, we had to send our healthcare workforce to go and assist them.